So thank you, sir, for giving me this opportunity for this oral paper presentation. First of all, I'm working as a medical advisor in Novonordics. This is my financial disclosure. And I'm going to take this paper because the oral semaglutide now the treatment guidelines is changing AD as well as the ESC as well as most of obesity guideline is changing day by day. So this is the main cause of therapy for the most of patients are using it or using as well as it's already on the GLP-1 RA therapy as well as a 2G and 3G therapy. So let's just start. This is an introductory slide. As you see, the first of all, there's a oral GLP-1 because it is a first in class therapy, which is a semaglutide, which is a peptide in a pill. So nowadays, so there is a only first line therapy. This is a one of the therapy which is going to be in the given in the oral formulation. Till now, we don't have any oral formulation which is going to be in peptide form may facilitate the increase the access of the benefit of the GLP-1 RA therapy in the broader CAT settings. So what I did here is I just drew out the data from the Pioneer 6 because I'm working closely with the known orders. So Pioneer 6 is a CVOT, which is a cardiovascular outcome trial, which is going to be all the anti-diabetic drug before the marketing authorization from any of the country. We have to do the non-inferiority study with the CVOTs. And this data I utilize and I just do the cross-functional analysis. And what we do is because GLP-1 receptor agonist is a peptide-based therapy. So when you did the incretin, when you receive the incretin therapy, the many of the patient is off label or off label using, and maybe they are discontinuing me in the long run. So this is the main purpose to analyze this study. So therefore, we aim to assess the role of medication management strategies within the physicians, which is going to be used in the future line in the treatment therapy, the lifestyle as well as standard of care. So we divided into patient into three main strategy. So first, the patient who educated as a needed to be address the GI tolerability issue throughout the trial. And if the adverse event were absent or manageable, dose escalation continue as scheduled in the trial. Second patient group of the patient, if the adverse event were more problematic or investigator could reduce the obstacles, the dose will be seen and dose escalation resumed once the symptom resolved or diminish. And third group of the patient, if needed, the treatment pause were allowed and until the adverse event resolved, and the patient were encouraged to resume the treatment once willing to be, if the patient is willing, or if stop after more than 21 days, the re-escalation with the lower dose. So there are three strengths available: 3 milligram, 7 and 14 milligram. So the discontinuation of what we observed of the oral semaglutide was uncommon and mostly occurred due to the initial dose escalation. So when you escalate dose from 3 to 7 and 7 to 40, most of patients are going to be in this trial is discontinue or either it's a treatment pause. So most of the patient, 85% of the patient completed treatment therapy with oral semaglutide. So as you see here, the bar chart shows that the oral semaglutide, the median time of the trial is 16 months, so 1.5 years of the trial. So all the patient, 85% of the patient completed therapy, and number of event is more in the initial 10 weeks of the therapy. So first 3 months of the therapy, the most of patient oppose or the discontinuation. So either it is a in the long run there is a there are a discontinuation, but it is more common in the initial first week of the therapy. So when we analyze this patient, most of the treatment discontinued due to the adverse event, which is a gastrointestinal minor side effect, which is a 27% of the patient stopped taking of the oral semaglutide at least once during the trial due to the any adverse event. Now, out of this 27, 75% restarted after the first adverse event related to treatment discontinuation, and after in that 75%, 12% permanently discontinue the treatment due to the adverse event. And for the treatment pause, for the any reason, 23% of the patient receiving the oral semaglutide had more than one treatment pause, and out of them, the 70%, 72% had only one pause, and all the other, which is 85% of the patient, has a median duration of the treatment pause is 21 days. So what we concluded from this study. Treatment discontinuation, either it is a permanent or temporary, with oral semaglutide mostly occur during the dose escalation, which is a 3 to 7 and 7 to 14, and during the dose initiation and escalation. Patient education, shared management strategies may help to overcome this treatment persistent, which is the adherence as well as the compliance may be improved, and this barrier will be eliminated with the incretin based therapy, which is a oral semaglutide or any other injectable semaglutide. So that's from my end. Thank you, Bhasan.